90 million women use drugs worldwide, experiencing not only the inequities faced by women in general, but additional gendered disadvantages imposed by the effects of bad drug policy. Women are impacted disproportionately due to special measures such as the loss of child custody, coerced sterilisation, and punishment for drug use in pregnancy, while non-violent drug offences contribute inordinately to the incarceration of women around the world. With lesser access to harm reduction services, women who use drugs are an inadequately served population, which translates to unacceptably high rates of HIV and hepatitis C infection. The consortium seeks to improve access to services for women, to defend their rights, and to ensure that women who use drugs are visible in policy and programming. And since 2019, the consortium has elevated the challenges faced by women who use drugs within drug policy, HIV sectors, and within the women's movement.
In 2019, Harm Reduction International partnered with the Women's Harm Reduction International Network to host a side event at the Harm Reduction Conference. It provided networking opportunities for women involved in the harm reduction field, including women who use drugs. The event was attended by more than 40 participants from all over the world and was a dynamic and discursive session, facilitating idea sharing as well as networking, and included an introduction to the movement of people advocating for harm reduction services for women. During the interactive session, all participants were invited to contribute ideas about what narco-feminism means to them. The conference also hosted a safer space just for women and non-gender conforming people to come together and share ideas and support each other, and was run by the Medicineres team, which included peer workers, a doctor, social worker, social educators, auxiliary nurse, and a constant and gorgeous wave of professional, voluntary, and supportive women.
Since joining the Harm Reduction Consortium under RCF, we have consolidated coordination system, created an interactive websites with virtual library and watchdog blog, expanding social media presence while working to exponentially increase member activity for impact. And also, RIN coordinated a webinar titled The Place for Women in Harm Reduction Organization and Drug User Network in 2019 and worked with partners to prepare another this year in Women Who Use Drugs and COVID. A small grant scheme supported actions across 13 countries for the UN 16 Days of Action to eliminate violence against women who use drugs. We also worked together with Frontline AIDS on a sexual and reproductive health manual focusing on women who use drugs, which was launched at the CND 2020.
During the past 2 years, Eurasian Harm Reduction Association, together with the community of women who use drugs in Estonia and Kazakhstan, submitted reports to the UN Committee on Economic, Social and Cultural Rights and Committee on Elimination of All Forms of Discrimination against Women. Kazakh report is a good example of collaboration among sex workers, women who use drugs, LGBTQI, and women living with HIV. As a result of Estonian report, in 2019, CSCR recommended Estonia to investigate cases where women have been unlawfully forced to terminate opioid agonist treatment under the threat of losing their children. These recommendations helped shift the situation. Some of the Child Protection Service officers were fired. A special training for social workers were organized by the Public Health Institute.
A focus on women and mainstreaming gender perspectives into the drug response. Governments also agreed a new resolution on HIV prevention for women who use drugs, and the consortium pushed successfully for stronger language on harm reduction and on women in prisons. In June 2019, we hosted the 7th Global Day of Action for the Support Don't Punish campaign. Activists from 240 cities united to call for an end to the war on drugs. And in cities around the world, the focus was on the rights and needs of women who use drugs. The campaign logo was turned orange as a powerful nod to the international campaign to eliminate violence against women, a link that has been further developed in 2020.
RIN's strategies is to ensure inclusion of women who use drugs issues within the women's movement through campaigns and building awareness and partnerships. The glass ceiling has cracked but is yet to be removed. RIN and partners are planning representation at the upcoming AWID forum, and through the GDPI grant, RIN is now finalising arrangements for 4 RIN member internships with IRAW and with UN Women. Joining the consortium under RCF, has given RIN a stronger capacity for growth and impact. We look forward to strengthening partnerships as well as developing new bonds, particularly within the HIV and women's movements.